Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
We are happy to welcome Dr. Gordon Crozier, a recognized leader in both the research and application of integrative medicine and a pioneer in the field of genetics-based medicine. Dr. Crozier is a board-certified physician in the state of Florida and serves as the medical director of Crozier Clinic in Orlando, where he is also a practicing physician. Welcome, Dr. Crozier.
Thank you. It's good to be here.
When you were on our podcast back in 2019, you shared your personal health struggles with Lyme disease and then Crohn's disease, which ultimately led you to the practice of integrative functional medicine. Can you tell us a little more about Crozier Clinic?
So at Crozier Clinic, because of my own struggles, I realized that a lot of other people did not have the understanding of what was going on with their own health issues. And they were looking and they were trying to find somebody to really help them. So I like to try to help people understand why they are sick. What is going on with them? What's the true root cause of their disease system? I might not be able to help everybody, but if I can help them understand why and the root cause for their illness, at least it gives us something to work on, and it gives them peace of mind to know that they're not just crazy like they're told in a lot of traditional cases, that they're just crazy, but they're not really crazy. They probably have mold toxicity, they probably have chronic inflammatory response syndrome, they probably have something like that. And I try to help each one really understand what's going on in their body so that we begin to have some aspects of bringing them to better health.
Dr. Crozier, can you tell us about some of the functional medical protocols you use in your clinic?
So it depends on the individual patient, what kind of protocols I'm going to use, but everybody, they are going to have issues in their gut. So I begin a lot of times with the gut, and the gut-brain immune system, that triad, is kind of a triad that I've worked out for years. In fact, ever since becoming part of A4M back in 2004, I started to understand some of those things and those entities that needed addressed. So that happens to be kind of my wheelhouse, is the gut-brain immune system. There's other systems that I use as well, but that kind of gives me the platform to begin to help them. So we use different entities, perhaps peptides, supplements, a diet protocol, really introducing the correct probiotic for that specific individual. So it's multifaceted.
Is yours a cash-based practice?
Yes, we've been a cash-based practice for over 10 years. When I left the university, I left everything. I left my retirement, I left my secured income, and we just went out on our own. My wife told me, she says, you know what this looks like in 10 years. You don't know what this looks like in 10 years. I think we need to do it. And so I had the support of my family behind me when we went ahead and went totally cash-based. And the reason I have to be cash-based is because insurance will not pay for some of the modalities that we do. Now, I do give my patient ICD-10s. I give them all the codes for everything we do. And a lot of times they get some reimbursement from insurance, but not total. In doing a cash-based practice, I don't have my hands tied by insurance companies telling me what to do. I want to be able to do what's right for the patient, not what's necessarily right for the insurance company and their benefit from it. So that's why I refuse to take insurance at this time.
Recent reports have shown a decline in the number of clinicians within the United States that own a private practice. Most physicians practice in corporate healthcare. Does this trend concern you, and why?
This trend does concern me because it concerns me for the patient, because I don't think that patients are going to have freedoms to be able to choose. They're going to have less time with their physician because studies actually show that doctors who work for corporate America and work for corporations, they actually spend less time and they're required to see more patients than doctors who have their own private practice. So if you have your own private practice, you tend to take each patient really sincerely, and you want to spend the quality time to get to the bottom of their issues. And so that really concerns me that that's moving in that direction.
You are speaking during Module 1 of the peptide certification that is taking place live during the weekend of this podcast recording. What topic will you be covering?
I had a lot. I talked about metabolic resilience. We talked about the metabolism. We talked about different modules that can actually help you lose weight and get back in control of metabolic syndrome, of inflammation, metaflammation. We covered a lot. It was a long lecture. And I'm also speaking on something called SARMs. So that is something that actually helps with your androgen receptors, and that can be good and bad. And I'm going to be going through that completely, explaining the good, bad, and the ugly of SARMs, and there can be a lot of ugly with SARMs. So we have to make sure that we use these entities in a correct manner. And peptides, of course, I've used peptides for a long time in my practice, and I'm giving some clinical situations of where I have used it, and it's actually helped some patients.
Dr. Crozier, have you used peptides yourself?
Yes, I have. Peptides are a very integral part of our body. We have over 9,000 different peptides in our body. As we age, our peptides begin to decline and decrease. And so they can't be utilized correctly. So then we have other issues like your blood sugars going up. You have insulin resistance happening. You have inflammation increasing in our bodies, causing metaflammation. So all these things happen. So I have used peptides in multiple ways. And I use some that are actually considered kind of an antiviral type of peptide. And I've used some that are decreasing inflammation. So I use peptides all the time. And I love them, and I use them for a lot of my patients. But we have to be careful because you want to make sure that you're doing them under the guidelines and guidances that are indicated, because this is a new field. And not all of them are FDA cleared or certified. Some of them are not. Some of them have human studies. Some only have animal studies. And you have to make sure that if you're using them, that you understand the full implications of using them. So that is why this certification is so imperative for so many doctors, because it actually gives them some guidance to understand what are the proper modalities in using peptides, how to use them correctly, and what perhaps they shouldn't be doing with peptides. We want to be open for them to ask us questions, and we're there. We're here the whole weekend asking questions, even after the conference is done at night. We're answering questions for these people that have a lot of different things that they want to understand on how to use these appropriately, and we want to help each physician to be able to use it in the best way possible for them and for their clinic.
And last question. How do you ensure you remain healthy and grounded? Are there any practices, habits, or anything really that help you keep your best?
Wow, that's a loaded question. And I love it because I think that grounding as a physician, when you are constantly doing caregiving, we have to be grounded. And there are different things. There's biofeedback techniques that we can use to actually help ground us. I have a walking regime that I do almost every day. I walk and kind of meditate as I'm walking, and it helps me be grounded. It helps me to release a lot of things that are going on, that people that I don't feel that I'm helping quite the way I want to, because we always feel bad when we're not helping our patients the way we really went into this field to do. We wanted to help everybody. And so it helps to that for grounding for me. And I have an exercise program that actually helps me too. And then spending time with my family. My family means everything to me. I have 6 kids, and I want to spend as much time with my family as I can. And that's really imperative to me, is to have that family time.
Well, thank you so much, Dr. Crozier, for being with us today, sharing your expertise and your insights on peptides. We truly appreciate your time. Thank you.
Thank you. It was great to be here.
And thank you to all of our listeners. Until next time.